Good afternoon, everybody. Welcome to our COVID video update for January 7th, 2021. It's a new year. We hope you all had a safe and healthy holiday season, a good Christmas, and a good, safe New Year's. All of us on the panel today, myself, Andrea Matus, Pascua-Yaqui Tribe Emergency Manager, Dr. Renteria from the Health Department, Mr. Mavis from our IT Department, and Councilwoman Mrs. Gonzales. We're all going to pass on some information to start off the new year with, and I'll start off with statistics for you. So for the Tucson area, from all sources, dated January 5th, 2021, we have 1,330 confirmed positive cases at this time. Confirmed deaths is 23. And from the Pascua-Yaqui Tribal Health Services Division testing that was completed from March 23rd, 2020 up to January 5th, 2021, they had a total of 8,157 negative results, and positive results was 608, and positive since our last reporting date was 37. I'd also like to emphasize they had 611 recovered cases. And from the Guadalupe area, from all sources up there, which is Phoenix Indian Medical Center, Pascua-Yaqui Tribal Nursing Services up in Guadalupe, in Maricopa County, their total is 1,275 positive cases. From the data that they've received from Phoenix Indian Medical Center, it says that for the Pascua-Yaqui tribal members, the positivity rate was at 52% for the past week. So, please continue to distribute that message that cases are increasing all over. Please do your best to mitigate exposure. Wear your mask, social distance, disinfect as much as you can, and avoid large gatherings. And that's all I have right now. Thank you.
Okay.
Oh, Mr. Gonzales. Yeah.
So I have a couple of updates for the CARES Welfare Assistance Program, higher education, and also for COVID-19 testing for January. COVID-19 testing is available here in New Pascua at the Albert Garcia Auditorium. And that is from 9 to 11:30 and 1 to 4:30. So you do have to visit our website so you can register and get a confirmation number. They will ask for that confirmation number upon arrival. So again, January COVID-19 testing is available here in New Pascua at Albert Garcia Auditorium. For education, our higher education scholarship application was previously extended to tomorrow, January 8th, Friday, January 8th. So those higher ed students, you have one more day to get in any last minute application paperwork that you might have needed. If you need help, please contact the education department, your advisor, as soon as possible. Also, the update for the Pascua-Yaqui Care Welfare Assistance Program, that was the social services was taking applications for assistance. Although the deadline has passed in December 28th, they still have numerous outstanding applications that have not been completed. Fortunately, the tribe has until the end of this year to spend those funds, but those applications for sure need to be completed as soon as possible. So if you had an open application with them, please follow up with social services to complete those applications, and hopefully we can get you some financial assistance. Tribal Council is looking at how much money is left in that fund, and hopefully we're able to extend the application date further, but tune in for more information as soon as that decision is made. Thank you.
Thank you.
Okay, buenas tardes, good afternoon. This is Dr. Renteria, and I have a few areas I want to just briefly discuss with you. I'm going to give you the little outline and I'm going to address each one, okay? And this is based on emails I've gotten from community members and employees that really are asking these questions. Number one is actually from an article that Mr. Matus Sr. here sent me that came out from NBC News that said that Arizona is the number one per capita, has the number one per capita rate of new COVID infections in the nation. I'll address that. Number two is how does the Moderna vaccine work? Number three is who is in phase 1 to 3 of our vaccination plan? How will elders on the reservation be prioritized? Elders being defined as 65 years and above. And how will elders off the reservation be prioritized? For example, in Guadalupe and Tucson. And will getting the vaccine stop the spread of the virus? Can those that have an immunocompromised system, for example, people on dialysis, cancer patients, autoimmune diseases, get the vaccine? And can those that have immunosuppressed systems, like transplant patients, kidney transplant, lung transplant, heart transplant patients, get the vaccine? So number one, why are we number one in the nation with the rate of new COVID infections? Basically, the information they quoted in that article and other sources is the same reasons that we've been telling you here. The majority of people that are now getting positive is basically in 3 categories. It's those that are inviting people into their home that aren't usually people that are there, who are asymptomatic and they're actually infecting people. Large gatherings indoors, defined as greater than 5 individuals, being in a bar or a restaurant. Those are the 3 main categories that are causing over 90% of these new infections. So even if you, let's say, have 5 people, if there's someone there that doesn't normally is in your house, you should all be wearing masks 6 feet apart. Because even just small numbers doesn't mean that you're not going to get infected by someone who's your cousin who hasn't been there in a month, just because they don't have symptoms. So apparently Arizona is number one, and it's defined as we have 785 cases per 100,000 people. By using a denominator of 100,000 across the nation, then you can get a rate and you can compare. So we're number one. Number 2 is California. Rhode Island is number 3. So it's East Coast to West Coast and in the middle. So how does the vaccine work? For our Moderna vaccine, basically when you get the shot, it goes into your arm, in the arm muscle. Once it's in there, it sends a message that enters your arm muscle cell. This message tells your cell to make a protein that is expressed on the surface of the cell. It is not a live vaccine. It's just a message that tells you to make a protein. So it's not a live vaccine. This protein is expressed on the surface of the cell. It is identical to the spike protein on the virus. So once it's there, your antibodies see it, and they attach to it, and then those antibodies go to other parts of your immune system to make specific antibodies to the virus. And also there's other cells that it will trigger to attack it. So now if you come in contact with the virus, you already have a weapon to destroy it and it attacks it. So you won't get the infection or its side effects. The Moderna vaccine is 95% effective, which means in 100 people, 95% of them should not get the disease. The other 5 may become infected, but because they have some immunity, they're more likely to get a less aggressive infection or maybe no symptoms at all, but they can. That's why also, even if you get the vaccine, you have to continue wearing your mask and social distance until the majority of the population is vaccinated and the virus is eradicated in the general population. So that obviously is not going to happen for maybe a year and a half till we get most of the people in the United States vaccinated. This one is, who is in phase 1 to 3 of our vaccination plan? Everybody's following these 3 phases. Because we're a sovereign nation and go through the health service, we have some flexibility of what we want to do. So for us in phase 1, general categories are frontline health workers, emergency medical service workers, first responders, long-term care residents, elders 65 years and above with comorbidities, in other words, diagnoses that are chronic, here in New Pascua and Tucson, and essential service workers. Those are people that we need to run our services that are not necessarily a health person. Okay. Phase 2 is elders not vaccinated in phase 1 in New Pascua, Tucson, and Guadalupe. And all this is subject to vaccine availability. We don't know how much we're getting in phase 2 or 3 yet, okay? So it depends on that. Employees not vaccinated in phase 1, essential service workers not vaccinated in phase 1, general public with high-risk medical conditions. Phase 3 is, again, general population, remaining elders not vaccinated in phase 2, individuals who tested positive for COVID-19 and want the vaccine. And we also have residential homes here, like for example, Men's Path and things like that. And they will be vaccinated in phase 3. They're kind of like general population, but a little different. So this is our basic plan for now, obviously subject to change. And the other important thing to understand is non-elders who live in Guadalupe, we're recommending they contact Maricopa County, Indian Health Service in Phoenix, or the Nachi Community Health Center. All these folks are helping vaccinate our residents in Guadalupe. So if you're there, contact them first, okay? All right. So how will elders be on the reservation be prioritized? We've already created a master list of elders 65 and over who have at least 3 medical chronic conditions. So let's say diabetes, liver disease or kidney disease or lung disease that's documented. So the ones that have priority are those that have at least 3 chronic diagnoses. And then the next level is those with 2, and the next level is those with 1. And that's the same criteria we'll be using once we get to Guadalupe and outside of the reservation in Tucson. Will getting the vaccine stop the spread of the virus? If you get the vaccine, the 2 shots as recommended, it's 95% effective. The answer is yes. So because you can destroy the virus before it creates an infection, you won't spread it. For 95 out of 100 people, right? There's still 5% that for whatever reason maybe didn't make the full amount of antibody, or they have a disease that allows them to not fight it as well. So that's why we still have to wear masks and social distance, as I said before. But yes, in 95% of people, it will not spread. Okay. Can those that have immunocompromised systems, for example, those that have cancer on dialysis, or have an autoimmune disease like arthritis or scleroderma, things like that, get the vaccine? From the research I have done, the general recommendation is probably yes. You obviously have to check with your specialist who's following you, but there seems to be no reason why this would hurt you. So right now, I will probably do that case by case and explain it, sit down with those people and explain it, and have them make the decision. But right now, the general consensus is that you probably should, because if those people get an infection, they're really high risk of getting serious complications or maybe dying. The last one's a little trickier. Okay, those that have an immunosuppressed system, that's a little different than immunocompromised. Immunosuppressed is like a transplant patient. You got a lung transplant, a heart transplant, because now the doctors have to give you a medicine to prevent your system from attacking the transplant organ that you receive. So in the research I've done on this, there's 2 issues that are trying to be answered. Because we're priming your immune system, will the vaccine cause that immune system to be activated, and then it might hurt you? Nobody knows yet. The other is, will the medicines you're taking to suppress your immune system from rejecting your organ, do those interact with the way the vaccine is working to create antibodies? That is all being studied right now. So for right now in that group, I'm saying, look, you really need to talk to your specialist. If it's a lung transplant, obviously you got to talk to them. That's your heart doctor, see what they think. They may have more information than I do. So right now, that one, there is no real recommendation. But for those that are immunocompromised, the general consensus is you should probably get it. Okay. So that's all I have for today. And I'll be putting out probably a public service announcement on this with Maricela. And I'm hoping to get on the radio and having a question and answer thing. So if you have more questions along these lines, that you can call in directly and I can answer that. Then we have more time. Thank you.
Thank you, Dr. Mr. Mavis. Good afternoon, everyone. My name is Raul, Mavis, IT Director, and I'm here to give you an update on the wireless internet project. The first thing I want to say is appreciate everyone's patience while this is being installed and scheduled. We understand that Some of you had problems reaching through the number, getting the installations. We're working closely with the contractor, and they understand the challenges, and they are ready to respond. And so continue scheduling the installs. They will get to you. So the first update is, for some of you that have already had the installations and received the modem, the last step that needs to be done is the technicians have to come back and align the antennas to the nearest tower or signal to make sure we have the best connectivity you can. So right now they were put in and pointed in the general direction of one of the antennas, but they've got to come back and align it so it's got the best signal, so you get the best service. And so once the antenna is aligned and once the service is live, you'll receive a text message that you can begin using the internet. That text message, you may receive it from now up until later next week. So don't worry, you will receive the message once the system is fully live. So the fine tuning of the antennas and any bugs they encounter will be fixed between now and January 22nd. So if you do get a text message to go live and use it, and it sees that the service is slow, please don't worry. It's still being fine tuned. The full system will be ready to go by February 1st. That's the deadline to get everything up and running as a full service for you. And during that time, you will continue to see either personnel from Native Network or Solutions I3 working on installations throughout the month. And if you do have a scheduled install, we are asking you to please unlock your gates and put your pets away so the technician can go in and perform their work as fast as possible. If you're a homeowner and you have not scheduled the installation and you do want it, please call as soon as possible. The number is 833-364-0593, or you can go to pytnetworks.com and schedule the install there. The plan is to get all the residences installed by the end of January. But call soon because we're trying to get that schedule filled now, so we have a good plan moving forward. We can do the most installs every single day.
Mr. Mavis,
yes.
You said it was a 24/7 line?
Yes, the line is 24/7, and the support, once they install, that support continues for the whole year, 24/7. So we're not going to just give it to you and walk away. There is technical support that will be provided to you 24/7 for the next year, and no additional cost. That's included with the service.
Wow.
Yes, thank you.
Very good. Mr. Mavis, could you just please touch on the construction sites where the antennas are going up? Because I've received a few phone calls about what's happening in those areas.
Sure.
So could you let people know where those are at?
Sure. The tower closest to the reservation is on the west side of the reservation behind the golf course maintenance yard. That's one tower that's going to be going up. And the other tower is in the corner of Mark and Jeffries, and that's planned to go up as well. And then there's one more tower going up at Tortuga Ranch, which of course isn't affected here, but that provides services out to the ranch. I know that in the past I know there's concerns about how close an antenna can get and health hazards. I do want to ensure, I know there's a lot of stuff on the internet. I want to assure you that there is no health hazard by these antennas where they are at. They're high enough and low power enough that you will not get affected. You'll probably receive more of a radio frequency signal from your cell phone you carry next to you than you would get from the antennas up on top of a tower. And that's where the towers are going to go. And the reason for having these many towers is to ensure that we can cover the whole reservation from different sides to make sure you do get a good signal at home. That's where the tuning of the antenna comes in. They're pointing it to the strongest signal, whether it be that tower, the one in Mark and Jeffrey. We do have other two antennas that have gone up in the fire department and one in the education building. So any one of those antennas will provide the best signal to your home, and then going to align it, and then you'll get the full service.
So what I'm hearing you say is that with that structure, no matter where you live on the reservation, you should get pretty good reception.
Yes, that's correct. That is correct. And that was the goal, to make sure that there was no weak spots in the reservation, that everyone gets a good, strong signal.
Very good. Thank you.
Thank you for the questions.
Well, folks, you can see that there's a lot of good information coming out to start off 2021. And as Mrs. Gonzales said, there's testing in January at the Howard V. Garcia Center. but there's also testing at the Pasquayaki Tribal Health Services Division.
Yes.
So you can continue to call those numbers as well to schedule your testing there. We thank you all once again for tuning in with us. We ask you to please continue to be safe and wear your mask and remind other folks if they don't have one on to please have one on. Social distance and continue to wash your hands and be as safe as you can, folks. Let's take these numbers back down.
I want to say one more thing before we go. Remember, right now on the rate of positive tests, we're number 1 in the nation. So I'm speaking here directly to those that are young on our age spectrum, because for you, you really may feel like this is not a big deal for you. Even if you get the infection, odds are you're going to survive it. You're not going to have any major complications. But the problem is you are the person that is the carrier, that if one of our elders catches it, your grandmother, someone like that, they could die. So you need to understand that it's really not about you. It's about trying to prevent the death of some of our elders, and we've lost too many already. So please, social distance, stay home. Right now we're seeing these rates, these are the highest in Arizona, right? This is still part of Thanksgiving. Okay, we haven't even seen what's going to happen after the last holidays and New Year's. That's going to be coming in the next 2 weeks, and it'll be even worse than what we're seeing now. So please, do it for those around you that you care about. Thank you.
Thank you once again.